my daughter, who went to a local school, North Haven High School, and who became addicted her freshman year in college. She came down with a very bad sore throat, strep throat, tonsillitis, the whole 9 yards. She was in pain. She went into the family medicine cabinet. She took some leftover Percocet of my husband's at the time from when he had his wisdom teeth out. And with that pill, things changed forever. And there was something about it that Lauren will tell the story, made her sick, but also made her feel a certain way that she liked at the same time. And so when the effects of that pill wore off, she found herself taking another. And from there it spiraled. All of this unbeknownst, of course, to me, or her father, or anyone in the family. She came to me actually and said that she had a problem. And that's when we were trying to find help. And where do you find it? Called the insurance company, called the doctor first, called her doctor. The doctor had no advice for me whatsoever, didn't know what to tell me. He said, take her to the hospital. The only place that would even take Lauren was Griffin Hospital in Derby. So we went there, and she spent 2 days there, and then they put her in an IOP program, and we thought, okay, she's all better now. You know, this is great. She's fixed. Life is going to resume, and we're all good. Because we had no idea what we were dealing with at the time. It didn't take long before she obviously started using again. That seemed to be the pattern, you know, in and out of treatment, back in, back out. She would get some periods of sustained recovery, but they were usually brief. We thought that methadone was like, oh no, I'm not gonna, that's not the treatment for my kid. I'm not gonna put them on methadone. And that was really ignorant of me to feel that way. Because if I had known years ago that medical assisted treatment could provide the life that Lauren and I lead now, a productive, healthy lifestyle, without having to go in and out of rehabs and without all of the, you know, the visits and the failed attempts at recovery, if I had known that, we would have done this much sooner. The APT Foundation provides so many services for their patients that are so important to their recovery. And for my daughter, those services are essential. They have mental health services. They have primary health care services. They offer vocational services. It's a holistic approach to recovery. So when people just refer to it as the methadone clinic, it's so much more than that. I think one of the biggest myths about the opioid crisis is that it's a choice. People who suffer from substance use disorder have made a choice, and that also people do not recognize that it is truly a disease. They think it's a lifestyle. It is not the reality. It is not a choice. And it is a disease. And for those of us who live through it, we can attest to that.